I'm not sure if this next story comes as a surprise or just a bigger surprise than the surprise we already knew, because the government has been tipping its hat about this for the longest possible time, although trying to downplay it every time as well. I'm referring to the number of people who have left. Healthcare workers left the healthcare system in this province. And you've heard Christian Dubé, as late as last week, talking about how they're going to change things up and start offering bonuses to préposés, and suggesting that things have actually gotten better. Fewer people leaving in the last 12 months than in the previous 12 months. But then this week finding out that it turns out Quebec has lost almost 21,000 healthcare workers in less than 2 years. Aaron DERFEL's on the line, Gazette's health reporter on this story. So, Aaron, thanks for being here this afternoon. As I said, the surprise here is not really a big surprise, perhaps, until you consider that the government is now being fairly candid about it and yet still trying to play it down, right?
Yes, they are trying to play it down in the sense that, when you calculate the numbers, that it's 5,257 fewer nurses. That makes a difference, and that explains why, hospitals have had to close 2,000 beds across the province. There's just not enough nurses. And that has a ripple effect throughout the whole system, because you've got to delay certain types of non-urgent surgery. And then, because you don't have as many beds, it backs up into the emergency room. So it is a very serious issue. And it's not just nurses. There's a shortage of respiratory therapists and lab workers. And, recently I wrote a story about thousands of lab samples, being kept frozen at the McGill University Health Center. So it is a serious issue, and it might take a while before it gets fixed.
Am I right what comes to mind for me immediately whenever I read any of your reporting, but then also when I'm listening to the health minister speak, is that the fundamental problems here are not being addressed. Yes, they've got a plan to recruit new people and to try and get some people to come back or to hang on to their jobs, but they don't seem to be getting the real issue here, which is that the working conditions are making it such that people don't want to stay. Am I right in that's
yes.
never addressed?
Yes. Yeah, so absolutely, Natasha. Nurses have been complaining they've been forced to work more overtime. The government has begun to tackle that, so there's less forced overtime. But they're doing more and more work. The pandemic made the situation a lot worse, and there are plenty of nurses who went on burnout leave. Others decided to retire early, or to quit working, as a nurse, and perhaps starting a new career. Other nurses have gone to the private sector, and they're not necessarily working at these temp agencies, but in other types of clinics. And this ends up really hurting the public system.
When I hear Christian Dubé speak about this, and as recently as last week when he talked, Aaron, about the bonus structure they were going to set up now to attract more, RPAs into the system, he never seems to be necessarily, and I don't want to use the word panicked, but overly concerned, as if the government, in whatever measures it's going to use, will eventually get this sort of taken care of and things will get back to normal. But if you assume that back to normal means we'll eventually get back to where we don't have to report about thousands of people being off the job, that sounds to me like it's going to take years to accomplish.
I think it will, and you'll recall last January, Premier François Legault, he addressed this issue. He was talking about the shortage of nurses. He said it was a worldwide problem. It is, in part, again, because of the pandemic and burnout. And he said that it would take years to fix, because you need to train nurses. It takes a number of years to train them, and so you're starting with this shortage, and again, there's really no easy fix. What I did notice is that there was a slight uptick in the number of doctors, but just by under 300 for the whole province. That's really not enough to cover. There are literally hundreds of thousands of Quebecers who don't have a family doctor. So, what we're witnessing in Quebec, you're seeing some of this in Ontario, you're seeing some of this abroad, and so when jurisdictions seek to attract healthcare workers, they have to be competitive. What's the tax rate like in Quebec? What are the living conditions like in Quebec? And, in this province, obviously, you have to be able to speak French. So there are some nurses who might want to work in Quebec, but they can't speak French. So that acts as a barrier. And all of and what made things even more difficult is the Quebec Order of Nurses has this exam that the pass rate is just 50% for those who graduated before they need their license. In order to get their license, they need to pass the exam, and they need to revise this exam. So there's a high failure rate. They can't get them working, and so that's another hindrance. And it just boggles the mind that they couldn't have foreseen any of this.
That is being addressed, though, right? They have decided they're revising that test and they're giving people an opportunity to take it again, are they not?
Yes, exactly. Okay. So, but that low pass rate. Oh. This is not new. They've known about it for a while, for a number of years, and again, it's just reacting to this situation belatedly, right? Because 2,000 hospital beds have been closed, because there's a backlog in surgeries, because emergency rooms are overcrowded, because journalists are writing about this. Then, belatedly, they address this problem. But, Quebec had a shortage of nurses even before the pandemic, and the pandemic made it worse. And it comes back to what you were saying, Natasha, that you need, to make the profession more attractive. But at this point in time, it's very unattractive because those who are interested perhaps in going to nursing, they see that emergency rooms are overcrowded. They see that nurses are burnt out. That's why it's going to take, as the Premier himself suggested, a number of years to fix. This is it's just catastrophic when you think about it. Again, the fallout from the pandemic.
So I want to ask one last thing, because we've been focusing on nurses here, but with respect to doctors, to family physicians, that's been an issue here. 1 million Quebecers still without them. Government's going to speed up enrollment. Is this planning to make a difference in the short term, or is this again a long-term solution?
Again, it's in the long term, and what complicates matters in the Montreal area is that they have for doctors they give them these permits where they can work, and they allocate fewer and fewer of them from Montreal. Doctors are trying to fight this in court. And then there's the issue with Bill 15. This is Dubé's reform. He's going to say this wouldn't apply to doctors, but it would apply to any other worker who's unionized. They can work elsewhere. They can work off the island, closer to where they live, and their seniority won't suffer. So Montreal, as a result of this health reform, could lose tens of thousands of more workers, again, to the detriment of healthcare in the city.
Yeah, nothing but good news still. Aaron, thank you. Appreciate the time. Keep up the good work.
My pleasure.
Aaron DERFEL, Montreal Gazette health reporter. There you go. 21,000 people. The thing we didn't get to ask, and the government is pointing this out, at least the health ministry, is that a lot of these people, they say, came back to work to help out during the pandemic and then decided to leave.
Retired,
so if that makes a difference.
They delayed their retirement, and now they're all retiring at once.